Back pain. What is back pain? Back pain is a common problem. It is frequently resulted from the strain of normal muscles, ligament, or tendon, and not from critical issues. How is the back structured? The spine, or the backbone, is one of the strongest parts of the body, and it gives us a great deal of flexibility and strength. It consists of 24 regular bones, vertebrae that sit on top of each other, separated by in-between discs. Inside the hard vertebrae, the spinal cord travels well protected, bridging communication from brain to the rest of the body, aided by the nervous system. What causes back pain? Poor posture, lack of physical training, causing the back to stiffen, muscle strain and sprain. Some specific condition has been linked with a painful back, including spondylosis, sciatica, and spinal stenosis. Common related condition: spondylosis. As you have cleverly guessed, your back pain is affected by the wearing and tearing of the spine. As we get older, the disc inside the spine become thinner, narrowing the gap between the vertebrae. The condition may be worsening at the edges of the vertebrae and facet joint by the development of the bone cells or osteocytes. Sciatica. Sciatica is caused by the irritation or compression of sciatic nerves routed in the spine. This may result in link pain, numbness, or tingling sensation in the legs, pain traveling all the way down the leg and foot. Unfortunately, 60% of people recover fairly quickly, although in some cases it may take numbers of months. Other causes of back pain: spinal stenosis, bone problems such as fracture, an infection of the bone, inflammation such as ankylosing spondylitis. When should I see my doctor? You should see your doctor if your pain is very severe and lasts for a long period of time and significantly affecting your everyday activities. See your doctors immediately if you have difficulties controlling or passing urine, you lose control of your bowels, you feel numbness on the area of your anus or genital, you have weakness in your leg or unsteady on your feet. How a back problem diagnosed? Usually, it is a wait-and-see approach, as most cases of back pain improve by themselves. A quick examination can diagnose most back pain condition immediately. It rarely requires additional procedure. What tests are there? If needed, a rheumatologist may advise an X-ray, magnetic resonance imaging (MRI) scan, or computerized tomography (CT scan. What can I do to help myself? You can try physical activities, regular exercise to help you lose weight, as these can reduce the strain on your back. Maintaining a good straight posture whenever you sit, at home, walk, or in the car. When you have to lift something, try to bend your knees and let your spine move without twisting. You can relieve your pain and back stiffness by applying a heat pad to the affected area. An ice pack, for example, a bag of frozen peas, can also be helpful. You can try medications such as painkillers, paracetamol, or non-steroidal anti-inflammatory drugs. NSAID, a proton pump inhibitor which can help to protect the stomach from the medication irritating your stomach. Who should treat me? If your back pain is still not settled, you can see a specialist rheumatologist who can advise you on specialized treatment accordingly. Why back pain become chronic? Although it might seem like the right thing to do when you are in pain for some time, by avoiding common activities and movement can actually cause the back muscles to become weaker. Your muscle tissues can become fatigued more and becoming increasingly defenseless against further strain. Bed rest for more than a couple of days is bad for you and your back and make it harder to get going again. Try to keep active. Gradually increase your level of activities. Thank you for watching. God bless you and have a great day.